Family Medicine and Public Health, and also in the Center for Wireless and Population Health Systems with Kevin and Fred. And Marta and I'll let her introduce herself, are going to just tag team this first part of the presentation on integrating GPS, GIS, and accelerometer data. Marta.
Hi, my name is Marta Jankowska. I am a postdoc here at Center for Wireless and Population Health Systems. I have a degree in geography, and I've been working on the past year on this whole question about how do we integrate GPS, GIS, and accelerometer data.
So I'm hoping you see the next slide that says active living research. Could I just have a confirmation of that? Okay, is anybody hearing us?
Yeah, they are.
Yes, great, thank you. Got it, yes, thank you, good, good. Okay, so basically, active living research essentially summarizes this research that has been done about physical activity in space. And essentially it started at home. So if you look at the graphic on the top right-hand corner, one's home might be right in the middle of those circles, and there are different ways of looking at that environment around the home, different types of buffer, and different types of land uses that we would potentially match around somebody's home. And essentially, we're looking at what's the relationship between a built environment around the home and specific health outcomes. And we mostly see very consistent relationships between this concept of walkability and a behavior like walking for transportation. And has been fairly consistent relationships between fast food access and diet. So one of the things that we think is very important when we design these types of studies is that you need to maximize the variability, both in the behavior and the environment. So we've sort of taken that to the extreme in some of our work, and we have an international study of 12 different countries. And you can see from the bar graph on the right that across these different cities, there's a lot of variability in, for example, biking and walking. So you're getting the behavioral variability when you go across different countries. And then if you see on the left, these are just examples of relationships between residential density and two different behaviors. The top one is walking behavior and the bottom one is cycling behavior. So as you notice, the relationships are not necessarily linear and they're not necessarily working in the same direction. So essentially, if you look at the whole field of built environment and physical activity, there's very few studies that have sufficient power and variability to demonstrate these effects. So as you're thinking about designing your studies going forward, I think it's really important to test the limits and find different environments and people with different levels of the behavior, so you can see in which settings your interventions might be effective. So we've now moved towards mobile measurement of context and behavior, so not focusing around the home anymore. And these are the types of devices that our participants typically wear. The top is a sense cam, so a wide-angle lens that automatically takes pictures about every 20 seconds. We have a hip-worn accelerometer, a GPS device, and a wrist accelerometer. So again, we've not been using, in our studies, the phone much. We use research-grade devices where we can be sure about the accuracy and validity of the measurement techniques we're using. So our first research in this area that actually took us to being able to use GPS data and then looking at GIS data came from an R21. So again, none of this ability to look at the GPS data would have been possible without our first step in this process, which was developing the software to categorize it. So that's what Kevin and Fred will be talking about after our general presentation on some of the theory and the concepts behind what one can do with this data. They'll go into the details of then what you actually do in the processing of that data. So we have studies that are where participants have won GPS data in randomized controlled trials over multiple time points, 3 randomized controlled trials in that scenario. We have a study with folks from 6 to 80 years old, and then a subsample of small studies where people are wearing the SenseCam GPS and other devices, and that included cyclists, older adults, and Latinos. So we've basically pulled this data together to be able to look at what is the relationship between GIS and GPS in these data. So Marta's going to talk now.
So one of the challenges that we faced with analyzing this data is actually just the theoretical framework for understanding how we can integrate behavior, space, and time into one dynamic methodology. So this was from a paper that just came out in Exercise and Sports Science Reviews that we did that kind of looked at how these three different data sets in the center graph there, they can overlap with each other. So you can join accelerometer and GPS and get measurement of behaviors, of activity, speed, and trajectories, and etc. But once you overlap all of them together, you really start getting at this concept of dynamic exposure. So you can really get sensitive and accurate measurement of physical activity in specific spatial contexts. And we took that one step further and started kind of thinking through the analytical approaches to that data. And we decided there's three prime ways you can do that. You can slice the data up by time. So you can do time-weighted exposure analysis or time domains, such as mornings, commutes, weekends. You can look at exposure through space, so that's looking at locations or activity spaces, and a lot of other ways of doing that as well, or through behavior. So really focusing in on the specific behavior that you're interested in and slicing the data up that way. So this was really driven by this question of how do you even define exposure? And it's really been a big debate in this field of exposure in terms of behavior. It's not the same as exposure to, for example, poor air quality or exposure to lead. It's something that you have to see, you have to somehow process it in your mind, and then somehow that might eventually lead to you actually doing a behavior. So is it enough to just walk by a McDonald's? Is that being exposed? Do you have to enter the McDonald's? Is that being exposed? Or is it actually I'm eating a McBurger right now and that's my exposure? And that's a question we've really grappled with of how we want to define whether someone has been exposed. So these are, again, just taking into account this time-space behavior framework. There's different ways of conceptualizing this exposure. Is it a certain amount of time that you have to be somewhere that quantifies exposure? Is it proximity, spatial proximity? Or is it the actual interaction through behavior that would then define exposure? And I think that's a big question for any research in this area, is how specifically are you going to define exposure?
So one of the thoughts that we, as I mentioned, we came from this concept of your home, and essentially people thought of that as the built environment, and often thought that of as exposure, because you're exposed to the things around your home was really the concept. But essentially what we're saying is when you do these home-based analysis, what you're actually talking about is access. Do you have access to these things? We have no sort of data from somebody's home address, whether they were actually exposed to those things. So that's really the paradigm shift we're also moving towards, is that continuum of what is access versus exposure. So on the left-hand side, you've got examples of access, which are these buffers, different buffer types around home. And for example, on the bottom graph, that's where it's only the street networks that would allow you to have access. So if you've got a large canyon or a freeway, those things are taken out of your access metrics. Then if you move towards the middle, the top one, for example, is a standard deviation ellipse type graph, where basically all your data is put together and you create this space, but in fact you're not necessarily being exposed by all parts of that space. Other ways you can do this is to actually look at data points along a route and say, okay, I'm going to buffer each point and call that my space around me. But then really we've been moving a little bit more towards this final, on the right-hand side, the kernel buffer. So as you can see, in the middle of that kernel is the blue line is your traditional buffer, saying I'm affected by those things immediately around me. Whereas the kernel buffer allows that to degrade in a linear fashion if you want, or you can actually sort of create the size of the bell curve that goes over that. So basically we're saying you can be influenced by some things that are slightly closer and then by things that are further away, but there's not such a strict line of where your exposure ends. So then the other piece of work that we've been doing in conjunction with this GPS GIS work is then using machine learning to detect the behaviors. As we're getting better at conceptualizing where is space, we also want to make sure that the behaviors we're detecting are also more specific and more accurate. So, for example, at the moment, accelerometers has been predominantly used to look at moderate, vigorous physical activity. And really, the physical activity is a little bit misdirecting, because it's basically, you're saying moderate to physical intensity movement. And physical activity is more of a behavior, and we have to be careful about those behavioral terms. So, for example, on the top left, the green chart shows us if you have an accelerometer on your hip, on the left bar, and if you have an accelerometer on the wrist, the types of counts that you would be getting while walking a specific behavior. So what that shows us is that accelerometers on the hips greatly misclassify walking. They're missing walking most of the time. Most people do not walk at the intensity that is moderate physical activity. And then the wrist, you're getting a lot more movement. And so this would be to be expected, but the point is these type of intensity cut points are not really the way we can go forward with. And it's the same problem with sitting. Accelerometers on the hip actually do a very good job of picking up sitting and classifying sitting. But again, the wrist, because of the amount of movement, wouldn't. So the point is not to say that these locations are poor locations of measurement of physical activity. It's just poor cut points. So we've been developing machine learning techniques to detect different behaviors, not different intensities. So we would be looking at things like sitting, walking, biking in a vehicle, etc. And we basically use a leave one subject out cross-validation for that work, and we're using random forest classifiers to define these different behaviors. So the work that we've been doing this in, we have combinations of classifiers that use both the accelerometer and the GPS data, again, applying these to different cohorts for women at risk for breast cancer, and we'd be comparing the traditional cut points to these new behavioral cut points. And both these studies have outcomes of insulin and inflammation from blood assays. We also have a study where we're looking to see if we need different algorithms across different age groups, and what placement, hip, wrist, or with or without GPS is helpful. We've been helping a group in Seattle detect cycling, and they used hip and ankle accelerometers and GPS. And again, they're doing an intervention that they want us to be able to pick up cycling, because if you use traditional accelerometer cut points, all pretty much 98% of cycling is missed. But these new algorithms detect it with much greater accuracy, almost the opposite, 90% accuracy. We've also been funded by the NCI under the provocative questions, again using hip and wrist accelerometers and GPS. And in this one we have also the built environment, and again we're looking to see if we can use dynamic exposures and specific classifications of behavior. With our risk data, we've also been trying to see if we can detect eating gestures. I know that's of interest to this group. And we've also been using computer vision, to see if the machine learning can help us speed up our annotation of our image data. So one of the examples of a built environment study is this PQA4 study. So basically in that, we were looking to see if we could see the relationship between walkable environments, physical activity supportive environments such as parks, recreation centers, healthy eating environments such as grocery stores, fresh product markets, and unhealthy eating environments. So essentially we're assessing those by GIS, but also through exposure using GPS, and then we're looking at total calories and physical activity total calories from a 24-hour recall. We're seeing if those behaviors moderate relationships between inflammation and insulin resistance. And so one of the questions there, we start to think about, is this actually big data? So we have 700 people, 14 days, 24 hours. The accelerometer data is being matched 30 times a second. So the numbers do start to become impressive. As I tell my son, my 6-year-old son, when he sees numbers like this, we call it a zillion. That's the best we can do. But essentially, once you start to match those with all the GIS variables that could be hundreds, if several hundreds for each point, you start to realize that it is pretty it's unmanageable in the current systems that we had been working in. And one of the parts of this PQ study is this subsample, so I wanted to alert folks to this opportunity, is that in 50 people we proposed to add SenseCam to their GPS so that we could have more detailed images of the context. We're also proposing to do some in-person interviews using this Veritas system that can take the images and the GPS and feed those back to participants. So that's potentially an opportunity where we could conceptualize of some of the EMI messages that people might be getting. We're asking folks to wear a phone, including capturing some audio, because we have a machine learning specialist interested in that particular data feed point. And in this, we really are trying to look at the genome in their blood and then potentially collect microbiome as well. So as you can see, this study is trying to reflect all parts of the different levels of environment and behavior represented in the graph on the right that Kevin has been proposing for the Precision Medicine Initiative. So Marta's going to talk about example 2.
So our second example, since we know you guys are really interested in trying to somewhat know what someone's doing at any given time in terms of eating, we just ran a study and are wrapping up the analysis on joining GIS and GPS and just using those two technologies to try to predict somebody's eating behavior. So we had 78 participants in this, and we used the GPS and GIS to try to define an eating episode, and then we used the SenseCam devices, which are the person-worn cameras, to validate the findings. We joined this on a GIS with our San Diego County Department of Environment Health Food Facility Inspection database, and pulled out from that all NAICS limited service restaurants, so basically fast food outlets, and NAICS full service restaurants, so basically sit-down restaurants. So we had a total of 5,326 locations for San Diego County. And of course, we were only trying to determine fast food and sit-down eating behaviors. We fully understand we can't really get at-home eating behaviors from this kind of data. So first of all, we wanted to define an eating episode, and the way that we went about it was that we buffered each restaurant location to 20 meters, and we did this because after validating our geocodes, we found an average error of 12 meters and also an average square foot restaurant retail space. We found information that it was about 20, it was like 22 by 22 meters. So we thought the 20-meter buffer was a pretty good size. We intersected that with our GPS tracks, and then we decided that in order for an eating episode to be occurring, they had to be in that buffer for at least 5 minutes. And we came up with 5 minutes as simply the amount of time it would take to go into some place, order food, or go through a drive-through. But then we wanted to have it be long enough that someone couldn't simply walk through the 20-meter buffer without stopping and it be picked up as an eating episode. So once we had our eating episodes defined, we validated them with our SenseCam data. We classified each SenseCam eating episode as matched to the GPS data to either say it was non-matched, so the individual was not in any eating location, it was just a straight up error. It was a match, but then there's 3 options that you have to think about. They could be in the place and they could actually be eating. They could be in the place and they could be taking the food to go, Or they could be in the place and they could just not be eating there. They might be with a friend, they might be doing something else in the establishment. And then finally, there's a third type, which was basically that the GIS was misclassified. So it was classified as an eating establishment, but maybe in our GIS it was fast food, and from the SenseCam we saw it was a sit-down restaurant. On the other side of it, in order to get an accurate measure of sensitivity, we actually took the SenseCam images and coded all possible eating episodes out of the SenseCam data, and then extracted all fast food, sit-down, and takeout episodes from that. So we did a positive predictive value and sensitivity analysis on this data. And in the graph in the upper left-hand corner, you can see that 76 out of the 200 and 76 of the episodes were true matches. So our GPS-defined eating episode matched with our SenseCam eating episode. 133 were not. So the GPS said that the person was there eating, and the SenseCam said, no, that's not what happened. I'm sorry, that was 54. Sorry. So 54 instances happened where the GPS identified it as an eating episode and the SenseCam didn't. And that really often was happening in places where you had multi-storied restaurant situations. So on the ground floor there was a restaurant, but they were going onto the upper floors to either their home or their office, and they lived above a restaurant. That happened a lot. Or you just got a little bit of GPS error. So their GPS was drifting into the buffered food locations. There were quite a few episodes that we found in our SenseCam data that were episodes in our SenseCam data that didn't get picked up in the GIS as GPS eating episodes. And if you look at the false negative descriptions, a lot of those were at home, eating episodes at home, work, etc. But 59 were restaurant or fast food venues. And so those are really worrisome. Those are times when someone's eating, but our GPS/GIS methodology did not pick them up. So we looked, I'm going to skip over this for now, but so we looked into what were those episodes that were missing, and we found, first of all, a lot of them were out of the county or we didn't have GPS data, so we threw those out. But then we found that a lot of them were food matches, but they simply missed the buffer. Some were not food matches at all, and then a lot of them were beyond any food buffer that we could find. So basically what we came to the conclusion of was that 70% of these missed episodes were due to bad GIS data, and that was a big problem for this study. So that brings us into some analysis data and analysis challenges that we want to share with you guys, just as a heads up as you kind of enter into this type of research.
So again, when we started out with our access data, we were talking about, for example, what might be your weekly behaviors related to a home address. So then as we started to actually get mobile data, we could sort of say that people were active at a daily level. If it's to their access, that doesn't change much on a daily level, but if you start to match it to their exposure, that starts to change. Then within daily levels, you can look at different bouts of activities. We've started looking more at minute level, and you could even start at looking at the epoch level. So for example, if we were collecting data every 15 seconds, which is what we do with our GPS, then again, the data points are getting more and more complex. And yeah.
I'm just wanted to say that this is really important in how you define any kind of episode. So is it a match? So are you going to trigger an EMI warning when it's a minute-to-minute match of your GPS and your GIS and a behavior? Or does there need to be some consecutive bout of a behavior occurring in order for there to be a match? So it's really important to think about how this data breaks down in order to define these kind of behavioral bouts, or is it a daily average, or etc.
And so then from our perspective, statistically, we're having to deal also as we move into more specificity and smaller measurements of time and location of different levels of nesting, because you're starting to talk about minutes within days and days within people. So we've had to do different statistical approaches because of that.
Anytime you collect GPS data, you're going to have a ton of missing data. There's definitely, and all we're really saying at this point is you need to impute it in some way, shape, or form. So when we looked at data for 782 people with about 6 days of wear time, a vast majority of them had missing data. We had average of 15,000 lapses with 52 minutes in length. So in total, 17% of their data was imputable lapses, so things that we actually could take a last known point and first known point and impute out where they were. However, another almost 18% of the data was missing with no previous or prior point, so we couldn't impute it because we didn't know where they were or where they were going at the end of the day. If you look in these graphs, what they're simply showing is different permutations of people that where they have really good data on the left-hand side, so that's your ideal situation. You really have almost all of your data, and the blues are at home and the greens are not at home. And so here we only had to impute a very small amount of data. In the middle, you start seeing a lot more imputation, and especially when they're not at home. And this is really worrisome because essentially, if you're interested in capturing behaviors outside of the home, obviously you want most of that GPS data to be present. And then on the right, you start getting into individuals that just have awful data. And you're going to have to figure out ways of, do you throw these people out? Do you impute that data? What kind of assumptions are you going to make in order to get that data back and make it so you can actually make any kind of assessment of what they're doing? Another huge issue that we have is spatial uncertainty. And this is going to come in a lot of different layers. So you're going to have the GPS uncertainty, you have scatter, missing data, and I think Fred's going to talk more about that. You have the GIS data uncertainty. So is your GIS base layer good? Do you have enough data in it to make accurate assumptions about what a person is doing in certain locations? As you can see from our food GPS food behavior study, a lot of our error came from this bad GIS data, or not bad, but just it's hard to have a consistent update of food environment. And then as you aggregate things, you're going to be introducing uncertainty based on the assumptions you make in those aggregations. And problematically, these errors will layer on top of each other. And so right now, we don't really know how they layer and what kind of situations you get really nasty data versus passable data. But it's an important consideration as you move forward. For our studies, we decided to put all of our data into a HIPAA compliant geodatabase to do all the processing with. Again, it's a little different for you guys since it's real-time data. Ours is collected and then we take it into an environment, we process it there. But it seems, I think Fred and Kevin's team are building a nice processing environment for you, but it's just important to consider that these are massive amounts of data that processing does take a really good cyber infrastructure to be able to work through it all.
And so really we just wanted to end before Kevin and Fred go into some more details on Palm's platform for MD2K. Obviously, we think we're making a lot of progress in terms of the specificity and accuracy of both the behaviors and the context in which they're occurring. Some of the challenges we've highlighted here. I think also it's important to think about positive and negative drivers of behavior. So, for example, in some scenarios, you can feel fairly confident, for example, if you're going into a fast food store, that this is a pretty negative environment and negative behaviors could be occurring. It's not so clear if you go into a grocery store if that is the same, if you can be sure about whether it is positive or negative. So, one of the things that a lot of people in this area of research is doing is not just talking about the environment itself. So I could be going to a park, but is that park full of gangs and drug users, etc. So the quality of the environment, it can also be very important. So I think that's important to consider if it's relevant. Again, we mentioned the challenges of moving into a real-time processing environment. We've faced a lot of these challenges, and we're not in real time. Also, I think it's really important to understand what data does have meaning and what data is noise, because there's a lot of noise in the GPS, potentially in the accelerometer and GIS, and as Marta said, those layering upon each other. Another thing I think you'll see from what we did, we had to be very specific about what an event was. We said an eating event was 5 minutes. What is a location within a 20-meter buffer? You'll have to be making those types of decisions as well. And again, what thresholds are working, where you're going to be getting positive and negative hits because of the decisions you make there. And again, because of the error in the geocoding, because of the error in the GIS, because of the error in the GPS, we had to be quite broad in those definitions. So when you move into real time, I think you're going to want a lot more specificity, but those errors are still going to be there. So maybe sort of trying to establish what that is with an early cohort, basically being aware that you're going to be making errors, but then at least trying to work out the threshold of where they occur and when. And finally, again, we really recommend whatever data you are using to be doing some validation, especially of the environmental data. So either using something like the cameras that we use, or actually going out feet on the street and doing audits, because you just at least want to know what that error is. And as I mentioned at the beginning, in all the data that we use, even in our PALMS validation data set, we push the extremes of the environments that we collect our data in. One, because we want to know, okay, what scenarios is there more or less error? But then also, even from our design, if you're trying to say that there's a relationship between an environment and behaviors, you have to have variability in both. So you would want to know, okay, which environments push that variability and which environments push the error rates. So I think that's all from Marta and I. Kevin and Fred will now talk more specifically about PALMS for MD2K.
So I think we'll finish, and then we can open it up to questions. So Kevin, thank you for being here. I'm not exactly sure where the camera is, right there. So just again, this all began about 8 years ago with the PALMS project, which was funded under the same. This is where we first met Santosh. And where is the driver? Okay, and this was part of the Gene Environment Initiative. Just for those of you who weren't around then, remember this is this portfolio of projects that was stood up by Francis Collins when he didn't get his precision medicine initiative off the ground in 2004, to basically help all of us build better systems and approaches like you just heard about. I mean, the advances that have happened over the past 8 to 10 years have just been extraordinary. So, thank you. When we jumped into this, again, there weren't many people doing work in this notion of fusing movement-oriented devices and devices that also captured other things. You see there one of the bioharnesses that was out at that time. We were interested in sort of experimented with a variety of devices that captured activity and respiration and whatnot, and then sort of the research-grade GPS devices that were available at that time. And you see there the list of the ones that we used. So essentially, we again experimented with this notion of capturing these data and fusing them together and putting them on a map. So we were trying to do this in Google Earth, and could again get some estimates of light, moderate, or intensive activity, and then could construct pictures of a day or a week or a longer period of time based upon what people were involved in. And again, this whole notion of envisioning where it is that people might be being exposed to the kinds of things. And again, you've seen how far along the methods have advanced. But if you know something about the level of activity, and you know something about the level of respiration, and you know someone's weight, you can really come up with some fairly substantial estimates of what what folks might be exposed to with respect to environmental contaminants. And some of our other research has been looking at that in the CitySense project, where we really are interested in pollutants that people of various ages can be exposed to. So what's interesting is that this platform has generated, not in addition to the research that Jacqueline and Marta have been talking about, a lot of interest around the world. Many people are grappling with this, and it's been, even though we haven't been funded, we've sort of opened up the door for this particular project to have people come in and experiment with putting in some of their data, and we could get into some of the examples that have happened around the world. But it's been interesting, and I think, again, Jacqueline and Marta have been part of this international group of folks that are doing work in GPS and the environment. And this is really a pretty important backdrop for this. So based upon this, we have, again, we're contributing to the MD2K, the kinds of technologies that Fred's going to talk about here in a minute. So on to Fred.
Hi, I'm Fred Raab. I'm the system software engineer in the group and responsible for the PALM system. And PALMS is a sort of complete standalone system where people, those users that you see around the world, basically take their data, upload it and store it on PALMS, run calculations and algorithms against it. The results are also stored on PALMS, and then they export it either as KML files for direct viewing in Google Earth, or they can export it as a CSV file when they bring it into a GIS or a statistical package system or something like that. And so what we're doing for MD2K is taking those PALMS algorithms out of the PALMS system and building them as standalone data processing units or web services that can be called by your application. So you don't have to use PALMS, you don't have to store your data on PALMS. You can basically just provide your data to the calculation. The calculation will do its thing and give the data right back to you. And the main emphasis is on the GPS, processing the GPS data. So if we look at this on the left, we have the raw data from a GPS. This is basically me walking to and from our office several times. And then on the right, you can see how when we process it, we basically clean it up, get rid of a lot of the extraneous points, identify the center, that red dot and the circle around it is my office, the center. All those points or noise that scatter around it have been collapsed to that one circle. And then we've identified the various routes that I've taken and trips to get to the office, and they're actually color-coded by mode of transportation, which in this case is just walking to the office. So again, sort of step through this one at a time, how this happens. Again, here's the raw data for collected over 3 days. Every 15 seconds is a dot. We take that and kind of reduce it. Instead of looking at it every 15 seconds, we look at it every 30 seconds or perhaps every minute. That's a parameter you can set within PALMS. And this particular GPS that we use gives us the signal strength from the satellites, and we use that to classify points as being indoors or outdoors. From that, we then kind of detect the trips and identify the starting points of each trip, the ending points, when they're in motion, where they've paused. Those are those yellow dots. And in this case, we define the pause as basically that they've stayed stationary for a 3-minute period. Classified by mode of transportation, and this we've done purely based on speed and speed thresholds. And then finally, identifying locations. And the size of the circle is based on the amount of time that they spent at that location. So now I'm going to kind of walk into how we're going to do the implementation for MD2K. So we're creating initially 4 data processing units, which are going to be available as a web service, or they're actually a Java class that could be incorporated into your application. One is the GPS processing, which basically takes that raw data and just goes through those steps that I illustrated. And what that does is provides a minute-by-minute view of the person's day. So for every minute in time, we will basically say, this is where they were, this is how far they traveled, this is what speed they were moving, this, if we had activity level, we'd basically say what their activity was over that period. Then that process data, it can be fed into two other DPUs. One that basically just summarizes all the trips. So I'm only interested in how many trips a person has taken this day, what was their starting point, what was their ending point, how fast were they moving on average, how far did they travel. Then the other is on locations. So I'm only interested in the person's locations, and how much time did they spend at each location. And then a totally new DPU that we're creating is based on this point of interest, which I'll talk about. So for a given latitude and longitude and a buffer around it, what do we know about that place? And so it's kind of like, what fast foods have they been exposed to? What tobacco outlets? And we're going to basically be getting that information from three places right now. One is a local database, so that we can basically get data from the county's the restaurant, inspections, right? For tobacco outlets, all tobacco outlets have to be licensed because they need to collect the tax. And so all the counties keep databases of the tobacco outlets. So you'll have those databases that we import into the system. You might have databases that you've went out and did a site survey and create. And then we can go out and reach to Google and Yelp right now for other data that may be relevant, but is definitely not as accurate as the first two databases. And then for each of these DPUs, we have a JSON schema, which basically defines what the input stream is like, the parameters for the DPU, and finally that output stream. And I'm going to walk through each one of those. So this is basically the input for a GPS. And the key thing here to look at is basically for GPS, we need at bare minimum the date and time of the sample, the latitude and longitude. Elevation is nice if you can give it to it, the GPS provides it, most do. The next one is the NSAT, which is basically the number of satellites that were used to get the fix, the small number, and the number of satellites that were in view. This can be used as an estimate for indoors, outdoors as well, because if you see a lot of satellites and a lot are being used for getting the fix, that means you've got really good coverage and you're typically outdoors. And then that QSAT info, that's the information provided by the QSAT receiver. And some of this can be also be gotten from cell phones as well. So that's the GPU index or input. Then for the parameters, this is only a small number of the parameters that are available within PALMS. And all of this is documented and will be published shortly. So, and this is just a sample, that there's a characteristic, a general classification, and then details within each one of those for trip detection, location detection, mode of transportation, etc. I'm just trying to give you a flavor of what this is going to look like. Also, each one of these parameters has a default. So if you accept our defaults, you don't have to specify it. So basically, you can run the whole thing. Do your initial analysis with all the defaults, and then look at the results, and then figure out, well, why is this, wrong, or why do we have high errors, and then tweak it, the defaults. Then this is the output, and as you can see, for each timestamp, and we'll give the timestamp every 30 seconds or 15 seconds or a minute, whatever you specify, the latitude, longitude, the elevation of that at that time stamp, the duration, the distance traveled, the speed, the bearing when you're on a trip, what direction, the difference, the delta, your change in direction, change in elevation, and then the number of codes. So the fixed type would basically be whether it was an accurate GPU fix, or whether we made an estimate, The IOV is the indoor-outdoor in-vehicle flag. Whether you're part of a trip, the trips will be numbered, and the trip type is whether it's a starting point, an ending point, a pause point, in motion, etc. Okay, so that's the output of GPS processing, which is then can be fed into, say, the next DPU, and this was the trip summary. So it basically, what's the start of the trip, what's the end of the trip, the duration of the trip, the distance traveled, the average speed, the locations, and the starting latitude, longitude, and elevation of the location, and the ending as well. So this is a way of going through that massive amount of data and finding, say, the 10 trips that that person has taken. Likewise, you can just summarize the locations and just give me the 10 locations or the 15 locations that the person has visited during the course of a day. And then for each location, we can get drilled down and the details that are provided by that for that point of interest. So this is basically, near my office, there's Earl's Place across the street, and this is from Google, and it's classified as a restaurant of food and an establishment. And it's got the postal address. So the parameters to the DPU, so one of the ways you can access the DPU is through the other DPUs, right? They'll call it automatically, or you could basically just pass it a latitude, a longitude, a buffer, and the type. So if I'm interested in food outlets within 30 meters of these coordinates, then it will basically, and in this case, I'm saying I'm interested in what Google said. Out will come that previous information, or you could basically leave the types alone, and you'll get everything that Google knows within 30 meters of that buffer. And like I said, right now the sources of that can basically be a project database that we've imported, Google or Yelp. We're also looking at Foursquare as another open source. So that's it in a nutshell, and much more details will be available as documentation, as well as the code will be published, and we're cleaning that, or I'm cleaning that up right now and getting that ready for publication. So
we're very happy to take questions.
Do you know how to manage? So I think they're supposed to be typed in here.
So we're waiting to see any questions typed in.
Also, can we talk to people? Can we?
Is there any audio? Yeah.
Well, I think we only have audio with the center.
With Barbara?
Yes. And then the people who are in on the webinar are online, and they could do the online questions for us. But
it appears there are no questions.
oh, there's one. One just popped up.
So one of the questions is the indoor-outdoor detection from GPS. How much accuracy do you get? So we've tested this in two different ways. There's two published papers out there. One is from observations of kids coming in and outdoors in a preschool environment, and that was done with somebody actually observing indoor and outdoor time. The other was from our SenseCam annotated images where we had indoor and outdoor time. So basically, we're looking at about 85% accuracy. We have a threshold that we use, and from that with 85% accuracy we can establish indoor or outdoor. So probably the one with the data from preschool might not necessarily have been a challenging environment. Certainly the SenseCam data was totally free living, so that it would have also been affected by things like tall buildings. And we have a validation data set as well, where we had a lot of variety in the types of buildings that people were going in and out of, and the urban environment. So it is affected, but on average we're saying about 85% accuracy.
And that was simple cutoffs, right? We didn't really apply any machine learning to that. And so, you know, I think we could probably improve the accuracy looking at other variables and in doing some time series analysis. Because if we determine that a person is outdoors, and I mean, right now, I know PALMS has a simple algorithm where if we see a you know, outdoor transition and one blip of indoors and another continuous output, you can basically assume that indoor blip is you know, that they weren't indoors, that they were still outdoors on the street. But any other questions?
While we're waiting for the questions, I don't know who's on the call. I don't think we can really see names very well. We just see other things. But I'm wondering, again, now that you've seen this, and I know we're talking about congestive heart failure and smoking as the two use cases. You know, in some of our calls, the Thrust 1 calls, we've been talking about the lawn data related to establishments that might be able to sell tobacco, for example, in the smoking use case. And I think that we had that in Chicago and maybe Columbus as well. Was that available there? You were present?
Yes, yeah.
Yeah. So, so to me, you know, again, part of it, and you see the very substantial portfolio research that Jacqueline and Marta ran, and then you see the system, which was really primarily built to capture data and, as Fred mentioned, look at it later. How do you think, and in what ways can we think about our future direction to move this a little bit closer to the real-time aspect of what MD2K is really focusing on, with this notion of EMI, or just in time adaptive intervention. So again, not sure who's on the phone or who's on the webinar, but would be interested in any comments. And I don't know whether Barbara can open up a phone line for people. We're just looking at a screen here.
No, can't do that.
Can't do this if it says no. Okay.
Okay, but we're very happy. I think hopefully we can share email addresses. We're very happy to take questions offline as well. Sometimes it takes a moment to absorb the information. Hopefully you've got the slides, can hear the talks again in case anything was new and therefore not necessarily processed straight away.
Don't hang up after I stop.